So when people have failed all of the conservative treatment options for cubital tunnel syndrome, there is a surgical approach where, similar to a carpal tunnel release, we open the cubital tunnel and we take the pressure off of the nerve so that the blood vessels and vascular supply can be reestablished and give the nerve the proper nutrients that it needs to function healthy in a healthy and proper way. Sometimes that nerve can be unstable from the groove that it lives in, and that requires what's called an ulnar nerve transposition, where we actually move the nerve into a new location so that it doesn't get pinched moving forward. In general terms, the cubital tunnel release is a successful procedure where most patients get a high function return of their nerve and are able to resume normal activities and overcome the symptoms that were preventing them from getting good sleep or having that weakness in their grip and numbness and tingling in their arm throughout the day, depending on the activities that they were doing. So by and large, it is something that can be treated successfully with surgery. Granted, the one thing that you have to take into consideration with nerve function is that over time, as that nerve has been compressed and has had the blood flow interrupted, it can deteriorate, and nerve regeneration is very slow and not as predictable as muscle or bone. Because of the difficulty that nerves have in regenerating just based on the type of tissue that they are, sometimes if you let those symptoms linger too long and that nerve has been compressed for too long, we don't hope for a full recovery of the nerve. We hope for improvement in the symptoms. It's important to get these things diagnosed and treated appropriately kind of earlier in the condition, while the treatment options are still likely to have full recovery of your symptoms. But if it's been present for 20 or 25 years or for a really long period of time, sometimes we're not able to guarantee a full recovery of that nerve because it's been diseased or damaged for too long. So it's really important that you kind of take that into consideration and take it seriously and really pay attention to those symptoms and don't just ignore it.